This is the Schroth Boss Podcast, a show that helps parents of kids with scoliosis find clarity in their path navigating the scoliosis journey.
You are about to be spoiled. Dr. Katie Blanchard, Schroth Method Physical Therapist and Coach, brings together physical therapists, spine surgeons, and parents to share and discuss tips and tricks for managing scoliosis.
Scoliosis is not easy, but don't worry, we've got your back.
What's up, everybody? Welcome to the Schroth Boss Podcast. I am your host, Katie Blanchard, and I am very excited to bring you Meghan Teed, a physical therapist, a scoliosis certified Pilates instructor, and a Schroth Method PT on the podcast here with us today. So welcome, Meghan.
Thank you. Excited to be here.
Yeah, I know Meghan is doing a lot of great stuff in the scoliosis world on social media and in person for her business. So Meghan, why don't you tell us a little bit about your mission being, a treater of scoliosis and a little bit about your business?
Sure. So I am the owner of Mindful Movement Physical Therapy and Pilates, and kind of my passion is simplifying the treatment of scoliosis so that clients can understand what's going on with their curve and be empowered to treat themselves long after I've finished working with them. So I feel like a lot of times, scoliosis is seen as this really complex condition, and it can kind of be like a scary beast to tackle. And I want to make it more friendly for people to be able to understand their condition so that they don't have a lot of fear surrounding it, and that they can feel like they can take control of their life.
Yeah, that's awesome. Yeah, with the diagnosis of scoliosis, whether you're diagnosed as a kid, as a teen, going on into adulthood, it can be a little bit scary of all of a sudden you're given this x-ray slapped in front of you and you have like a 35-degree curve and you're panicking of like what to do. So, simplifying it, letting patients know that there are ways to help is really, really awesome because it can be confusing. So is this something that you always set out to do? And did you always focus on scoliosis since becoming a physical therapist?
No. So, I have scoliosis myself. I'm not sure if I don't think I talked about that yet, but, so in physical therapy school, we had like a single lecture on scoliosis that was probably an hour long, and I don't feel like I learned anything different, unfortunately, about, how to treat my condition. It just kind of seemed like, oh, well, it's just like how you would treat lower back pain,
Mm-hmm.
And after I graduated PT school, I did travel physical therapy for 3 years. And then I worked in outpatient orthopedic and didn't really know that there was anything that I could be doing about my scoliosis until I had a local woman approach me about being her case study for a training that she was doing for Pilates for scoliosis Pilates. So I was like, oh my gosh, I was really excited that there was actually something that we could do with my back. And I learned a ton through that process of being her patient and her case. And then that kind of led me down the path of getting certified myself in, scoliosis-specific Pilates. And then later down the road, I did my Schroth training. So I just did my Schroth training in August of this past year.
Awesome.
So,
congrats on that. So you can really relate to your clients because you have scoliosis yourself. Can you talk a little bit about, the journey of having scoliosis yourself, and if there was anything you've learned that you could share with our audience, because there's a lot of parents who will be listening to this, or, people with scoliosis themselves, something that you can share with them that you've learned along the way, just about having scoliosis or managing it.
Yeah. So I was diagnosed in adolescence. I think I was 11 when I was diagnosed. And my curve was, I think, only like 15 degrees at the time. So we just kind of watched and waited to see if it would get worse. And thankfully I think it did increase a little bit, but it was never, enough to really do anything about, because the only other things that they would have recommended at that time would have been bracing or surgery.
Mm-hmm.
And later down the road, when I was in graduate school, I really did feel like my curve progressed during that time, because I did a lot of sitting and studying and hanging out in my curve, but I had no awareness of, how I should be positioning myself. And
Right.
so
Yeah, day to day can really affect, how you feel with scoliosis. And that's something that is not ever really addressed at all, unless, you really seek it out for yourself and learn and do that research.
Mm-hmm. So, I would say some of the biggest tips that I could give people for, traveling down their journey, is empowering yourself and learning as much as you can about your condition, so that you can be your own advocate. Because a lot of times you go to doctor's appointments and they are seen as the professional, as the specialist, and they'll make recommendations to you, but if you don't know your options, sometimes you might know some options that your doctor might not know. So
Yeah,
I think that that's probably one of the best things that I could encourage somebody with.
yes, for sure. Do your own homework. If you have scoliosis, learn the most you can about your specific condition, your specific curve type. Get second, third opinions if you need to. And there's always a way to be proactive, for sure. If there's an answer from, anyone who's treating you of just, wait and see, like there's nothing else you can do. It's a closed door. Dive in, get that other opinion, see what else is out there that you can be proactive to help your condition of scoliosis, help with any pain you may be having, help with any posture things, anything that you're worried about with your spine. So thank you for sharing that. That's awesome. Yeah. Have you had anything, a painful lesson that you've experienced because you have scoliosis, or through treating scoliosis, something, that didn't go quite the way you were expecting that you learned from?
So I would say probably my experience in graduate school is when I was experiencing probably the most pain that I've ever had with my scoliosis. And kind of over the course of learning what I know now about it, it tends to flare up when I'm more inactive and I'm in static positions for a long period of time. So whether I'm traveling or, sitting, working with clients virtually, I really try to be cognizant of the way that I'm positioning myself and taking breaks, movement breaks for elongation, like hopping over onto my pull-up bar, and just doing little posture resets all throughout the day can really add up and make a big difference in the way that I'm feeling. So just trying not to be in one position for too long. So thankfully it's not like a really extremely painful situation that I've ever had. I've had pretty low to moderate pain with my scoliosis, but I think that is usually the case for the majority of the clients that I work with, is, just that day-to-day kind of like nagging back pain can be solved pretty simply by just moving and adjusting your posture.
Yeah, definitely. And that's a great tip for anyone, listening to this, that, do your posture checks. More movement is better than less movement, so throughout the day, do those little posture checks, reset, and that can help you a lot in the long run. So in the topic of, pain, not all scoliosis patients or people who have it have pain. But some do, and some start to develop it as they get older and, get out of childhood into the teen, adolescent, and into adult years. And a lot of times, myself as a Schroth PT, I have a lot of clients that, will come in and say, I've had this like raging back pain that just flared up, out of nowhere. And I was told it's definitely not your scoliosis, it's something else. So how do you respond when, someone presents to you and says, scoliosis doesn't cause pain? Because that's something like we hear a lot.
Yeah. Yeah. Again, I always fall back on educating my patients. So educating them about the physiological reasons that they might be having pain. So it might not just be physical, it could be emotional. And a lot of times, all the time, it's half physical and half emotional, the reasons why we're having pain. And kind of delving into that a little bit more, looking into stressors that they might be having, in addition to, the fact that they have scoliosis, that definitely can create pain. So kind of reassuring them that what they're feeling is real, and making sure that I confirm that, and I don't just kind of brush it aside, because I'm not inside of your body, but you are feeling what you're feeling. So that's definitely real pain. I think that just being heard and understood can be really powerful in helping somebody heal from the pain that they're experiencing. If they're not feeling like they're heard, that can kind of amplify the situation. And I kind of go on and explain that there are people that have really, really small curves, so like 10-degree curves, that have a tremendous amount of pain from their scoliosis. And then there's people who have 90-degree curves who don't experience any pain at all. So it's definitely multifactorial, the reasons why you would be having the pain that you're having.
Yeah, definitely. Scoliosis affects the whole body for sure. And, we have to look at scoliosis as, a different type of spine than a regular spine. And that's where I feel like sometimes people get a little hiccup of like, I have pain, I must have a disc issue, I must have, a nerve issue, something like that. And we just have to look at scoliosis a little bit differently, because the spine is built differently and it requires maintenance. It's a chronic condition, compared to a regular spine that might not need that type of maintenance. And so that's something that, I like to educate my patients on as well, when they come to me with pain and scoliosis. So yeah, it's definitely multifactorial, multi-layered, and there can be a lot going on. But yeah, pain with scoliosis is definitely real, and it's definitely something that can be addressed and not ignored for sure. Mm-hmm. So I know you are a big proponent of like treating the whole person, the whole body with scoliosis. So can you just talk a little bit more about that as well? That maybe you're not identified as just, your curve, that type of thing.
Yeah, so I've done some training with Anna Hartman, and she is an athletic trainer, and she has worked with high-level athletes, and she teaches this system of assessing the whole person in front of you and kind of getting to the root of why you're experiencing the pain that you're having. So if you're having pain in your shoulder, it could be coming from a different part of your body, could be coming from your liver. So when you think about the shape of the scoliosis, and then you kind of peel back the layers and visualize the organs and tissues that lay beneath the spine and the skin, you have to consider that your organs are going to be affected by your scoliosis as well. So I do some visceral manipulation with my clients, and then I teach them how to do those things for themselves. And it can be really powerful for them to have the tools in their toolbox, and that understanding that, okay, well, just because I'm having pain in my right hip, that doesn't mean that I need a hip replacement. It could be, something else going on. So that's been really cool to see kind of that little shift happen for my clients.
Yeah, definitely. That's awesome. Like looking at the whole person, all the systems integrating and working together is really important. Yeah, that's wonderful. I love that. So just to kind of wrap a few things up here, I think this has been a really, really good conversation. Where can people find you online or in person, whether that be social media, a website, things like that?
So I'm on Instagram. I'm the Scolio-therapist over there. And I also have a YouTube channel, which is also the Scolio-therapist. And I have a podcast as well. It's called Ahead of the Curve. And I do some education on there. I try to teach on different topics that come up with my clients and followers that ask me questions. And I have a website as well. So
Awesome.
found in all those avenues.
Yeah, we will throw all of your links into the show description here or share it when this episode comes out for sure. But definitely, if you have scoliosis or if your child has scoliosis, follow Dr. Meghan Teed. She is really, really great. And she puts out really great tips and tricks that could help you along your scoliosis journey. So great. Are you working on anything specific at this time, like a new project, or I know you do like group coaching online. Is there anything specific that you'd like to tell us about?
So I have a 10 free exercises video that I put together for scoliosis. So they are really basic exercises to kind of get you started, get your feet wet, and start moving and thinking about your spine in a little bit of a different way. And then I have my small group coaching that I offer as well. And it's a combination of Pilates for scoliosis and Schroth Method principles that I kind of mix together. And it's really neat to see people kind of develop and transform over the 6 months that we work together. And I get to meet a lot of other people that are in the same boat as them. So that can be a lot of fun.
Yeah, for sure. Getting that group together, getting a community kind of going really helps everyone through their scoliosis journey. So yes, Meghan has a lot of great resources for you, a lot of great tools. So she would love to help you out. Meghan, final question here. Is there anything that you wish I would have asked you that I have not asked you yet? Something, interesting or something about you that we may not know, or something that you're really passionate about that you would like to share that you haven't talked about?
Yeah. So I would say just a little bit of like my history with scoliosis and activity. I grew up dancing ballet, and it was something where I think looking at the people that I work with now who are dancers or gymnasts, they come in and then I'm telling them, things about scoliosis, movements about scoliosis that, tend to not be as beneficial for scoliosis. And a lot of times, like with ballet and gymnastics, a lot of those things don't line up or add up. I would say, if you're ever feeling afraid of movement, try to you're probably not heading in the right direction if you're feeling afraid of movement with your scoliosis. And I think that that's something that I'm really passionate about, trying to make sure I gear my patients so that they feel like they can do anything that they want to be doing. And if you have scoliosis, there's no limitation on what you can do. So I think that that's really important to kind of hone in, especially, you working with little children and adolescents, I think that can kind of make or break people, the words that we use. So just encouraging people to continue doing what they love to do, and then giving them the tools to kind of help them to do it even better with their scoliosis.
Yeah, that's a great message. You don't have to stop or, stop doing the things that you really love, especially, for kids. We don't have to stop playing basketball. We don't have to stop doing gymnastics or cheerleading. Actually, it's been shown that these types of sports and activities can actually help your scoliosis because you're using all these different muscles and not just, being inactive or just doing one specific activity over and over. So thank you so much. Yes, we don't want to limit our patients. Scoliosis is not a limiting diagnosis that's going to stop you in your tracks. And there's always a way to be proactive about it to help you along the journey. Well, thank you so much for being with us, Meghan.
Thanks for having me.
You are very welcome. Have a good rest of your day.
Thanks, you too.
Thanks for listening to the Schroth Boss Podcast.
Want more info on scoliosis and the Schroth Method?
Join our free Facebook group or connect with us at schrothboss.com.
See you at the next episode.